The WA Country Health Service, or more affectionately known as WACHS, is the largest country health system in Australia and spans more than 2.5 million square kilometres, which is more than 30 times the size of Tasmania. Such vast distances has created some unique challenges, but the health of country people is always at the heart of everything we do. It's really vital for us to ensure that our country doctors and nurses and their patients know that when there's a medical emergency, help's at hand. With technology rapidly changing, this has created some really new opportunities for us to improve access to healthcare. So leveraging these opportunities has been really crucial for country WA. In 2012, the WA Country Health Service launched a pilot telehealth program. It was in the wheat belt and there was 8 small hospitals, and they were installed with some high definition video conferencing equipment. This equipment was used to link those hospitals with a small team of emergency medicine specialists hundreds of kilometres away in Perth. With the working title of Emergency Telehealth Service, the program quickly got known and became known as the ETS. And today, more than 100,000 patients have actually received care via the ETS. And it's our doctors and nurses who work in the ETS, who are over 100 strong, and most of them have worked or lived in country, and they're now committed to supporting their colleagues from wherever they're in WA or the world they now may be living. And this includes places like the UK and New Zealand. The impact of ETS can't be underestimated. Known as the doctor on the telly, the ETS is a trailblazer in the delivery of emergency medicine. And more than 70% of our patients are now treated and discharged or cared for at their local hospital, and this has reduced the burden of travel. The traditional ways we've delivered healthcare is being challenged, and it's challenging. So we've had to explore new ways of working. There are solutions, and technology is playing a leading role in these solutions. Country Health is embracing this new innovation as we strive to bring out the best healthcare to people living in some of the most remote parts of the world. Building on the success of the ETS, the WA Country Health Service launched a command centre in 2018. It brings together new and existing emergency and other specialty services into a 24/7 virtual clinical hub. Healthcare is changing vastly, and where we live shouldn't actually be a barrier to access high quality care. The WA Country Health Service Command Centre is providing around-the-clock access to a range of emergency and other specialty services, and it's all via video conference. This is supporting our regional nurses and doctors in delivery of high-quality emergency care. It's helping us to keep more patients on country and in their community and close to family and friends, and it's reducing the burden of travel, improving health outcomes and saving lives. The technology is integral to the Command Centre's success, and it provides instant connection between doctors and nurses in the country to a range of specialists in the city or in metropolitan areas. It's making a huge difference to country communities, knowing that they have immediate access to highly trained medical professionals supporting their local clinicians on the ground.
The Command Centre houses many emergency and specialty services to support frontline clinicians caring for patients in regional WA. We've already heard about the Emergency Telehealth Service, which provides clinical expertise to support emergency department presentations for more than 80 hospitals and nursing posts across WA. This averages to more than 400 consultations a week. The Inpatient Telehealth Service offers virtual ward rounds to patients admitted to country hospitals when the local GP may be unavailable. This means that a large number of patients who need to stay and be admitted to hospital can avoid the need to transfer to other hospitals when their local doctor is not available. This means care closer to home. The Advanced Patient Monitoring System will soon be another Command Centre innovation. It will use real-time data of a patient's vital signs, which will be analysed using advanced technologies such as machine learning and artificial intelligence to alert and support country doctors and nurses in detecting and responding to very unwell patients. Sometimes a patient will need to be transported to a different health site. In these cases, the Command Centre will use the Acute Patient Transport Coordination Service to facilitate safe, timely and efficient transport of these country patients to and from regional and metropolitan hospitals. If a patient needs access to a specialist, the Acute Specialist Telehealth Service provides frontline clinicians with access to a range of acute specialists, such as stroke, and soon we'll hope to be able to offer other specialties such as obstetrics and paediatrics. This will be using high-definition video conferencing equipment and digital technology. Mental health demands are increasing, which is why in 2019 the Command Centre added the Mental Health Emergency Telehealth Service, providing access to specialist mental health nurses and psychiatrists 24/7 whenever those services can't be provided locally.
We knew that when people in country WA came to one of our smaller EDs experiencing a mental health crisis or drug and alcohol issues, they often couldn't access the mental health care they needed because there wasn't a mental health clinician based at the site. So we see people across the age range, we provide assessment and treatment, we support the staff on the ground, and we liaise with families, local mental health services and so on to make the best plan for the patient. In more than 80% of cases, we can keep the patient in their local area, so avoiding the stress of having to travel for mental health care and offering Aboriginal people more culturally appropriate services on country. We also follow up our patients the next day after they've been in an emergency department to make sure that everything's going well and that the plans that we've put in place are working.
In addition to our patient care services, the Command Centre also delivers education to doctors and nurses in rural remote locations. And it's through this education and clinical simulation sessions that we're improving staff retention and starting to contribute to creating a patient-focused workforce. These sessions focus on specialist areas of emergency medicine and mental health patient care. A virtual reality education program is also in development, and this is focusing on clinical simulation, which uses VR goggles to immerse the learner in a virtual experience. Placing staff virtually in the medical event, they're so close to the action they feel part of the clinical team delivering care. This program also offers country clinicians a unique learning opportunity and complements the existing education programs provided in country.
The training ETS provides gives me extra confidence when dealing with life-critical incidents and challenging situations. Having an emergency specialist virtually in the room provides our staff with guidance and support, which is immensely valuable. This especially is important for our clinical staff after hours, where we do not have a doctor on site, and it sometimes can take a little while for the on-call staff to attend. Every minute counts in these life-threatening emergency situations, and have the ETS just that phone call away is an amazing resource for our clinical staff, and there's no doubt that it improves patient care.
The Command Centre has been a real game changer in delivering safe, quality care to country patients, and it's bringing a level of emergency expertise to country that the people in the city take for granted. Being on country or in your own community, close to your family and your friends, it's important to our patients, and with the support of the Command Centre, this is allowing it to happen more frequently. The WA Country Health Service is all about putting patients first, and we lead the way in developing innovative technology solutions to deliver high quality healthcare. Our vision is to be a global leader in rural remote healthcare, and expanding services via the Command Centre is just another way that we're helping to make this vision a reality.